Hey everybody, it's Jay again, and this is take 2 of physical assessment. So, you go ahead and do that. Hey Sam, how are you doing today? Awesome. My name's Jonathan. Salaries, you can call me Jay. I'm going to be your student nurse from Mercy College of Ohio today, alright? Alright, Sam, can you tell me what your full name is, please? Alright, what's your date of birth? Alright, Samantha, December 13th, 1956. Alright, thank you, Mr. Sam. Alright, I'm here to perform a physical assessment and get your vital signs. This will give us some baseline data on what your current state of health is and how we can treat you and get you healthy again, alright? Okay, you can assist me by just laying here and I'll give you some cues and ask you to help me with a few things as we go along, alright? Okay, first thing is nutritional status. Mr. Smith, what is your height and weight? Alright, have you had any recent weight loss or weight gain? Have you had any nausea or vomiting? Heartburn? Any problems chewing or swallowing? Do you take any vitamin supplements? Nope. Okay. Now I'm going to ask you your posture and gait. So I would get them up, help them assist them standing, ask them to walk, turn around, sit down, right, help him back into bed. So I noticed that his posture was upright and erect, and his gait was steady, and he does not use any assistive devices like a cane or wheelchair. Do you use any assistive devices, Mr. Antha? He said no. So after that, I'm going to go ahead and ask the brief medical history questionnaire. Alright, Mr. Antha, can you tell me what, if you have a history of a mastectomy? He says he doesn't. Do you have a history of an AV fistula or dialysis shunt? He says he does not. And is there an arm that I should not take blood pressure on? Alright, have you had anything to eat or drink, exercise, or smoked in the last 30 minutes? He says he did not. So now I'm going to go ahead and get my thermometer. I'm going to do this as it would be the checkoff. So I take the thermometer, stick in the posterior sublingual pocket, so under the tongue, in the back, and hold it, support the thermometer probe, take it out, read the temperature, make sure the range is between 96.8 degrees Fahrenheit to 100.4 degrees Fahrenheit, or 36 degrees Celsius to 38 degrees Celsius. Right, TP. Next I'm going to take the pulse for 1 minute while I'm doing. Right, Mr. Antha, I'm going to go ahead and get your radial pulse for you. Okay. Starting now. Yes.
Do you have a second?
I do, yes.
Okay, excuse me. We have those chicken breasts. I was going to slice some of them up and put some like taco seasoning.
Mm-hmm.
We don't have any shells, but we have like stuff for nachos.
Mm-hmm.
If you want something like that, or you can just leave it separate. I can make some separate and put on a salad.
Okay.
But what would you prefer?
I think the nachos would be good.
All right, make
Thank
plenty.
you.
Yep.
Alright. So for pulse, I got 32 beats per minute for 30 seconds, which would be 64 beats per minute. I got 7 breaths in 30 seconds, which would be 14 breaths per minute, which the pulse was regular, and for the breathing, no use of accessory muscles, no the depth was moderate, the it was regular, and it was unlabored breathing, and normal range for pulse between 60 to 100 beats per minute, and for breathing was in the acceptable range, which is 12 to 20 breaths per minute. Alright, Mr. Antha, next thing I'm going to do is temperature, pulse, respirations, and now I'm going to take the pulse ox. Alright, so forgot my pulse ox downstairs, but I take the pulse oximeter. Can I see your finger, Mr.? Thank you. Great. Up there, my fingernail bed. Right. Make sure he's laying it flat. Thank you, Mr. Antha. Alright, give it about 15 seconds to make sure an accurate reading. Check the pulse. Make sure it's within a regular range of what I just got, or otherwise I might need to retake it. And make sure the pulse oximetry reading is within the acceptable range, which is 95 to 100% blood oxygen saturation. Alright, Siri, leave me alone. That's not part of the checkoff. Alright, so next after that, I'm going to go ahead and set SB, BP. Now I'm going to take the blood pressure. And Mr. Antha said he does not have a preference which arm I take it on. So I'm going to bring that up. The first thing I would do was measure, make sure 40% around, or 40% right here, right? More than 40%, and make sure it's at least 80% around. Alright, check that. All the way up. Find the brachial. Good enough since it's a skeleton. Right now I'm going to palpate the brachial or the radial, so make sure it's good. I like the radial because it's usually a little bit stronger. Right, systolic is around 120. I'm going to go 30 above that, which is 150. Alright, was that alright, Mr. Samantha? Awesome. I'm going to do the little hold the arm steady between my arm trick. So that helps. Helps a lot. Alright, so that'd be 116 over 64, which is close to the normal, well, which is close to the average blood pressure, which is 120 over 80. Alright, thank you, Mr. Samantha. Take this off if I can. There we go. Put that over there because I don't need that. So now I'm going to go pain. Right. Do you have any pain right now, Mr. Samantha? He says he has some in his left lower leg. Alright, can you tell me where it is about? Right in his upper calf, or upper thigh. Alright, so P, Q, R, S, T. P, what provokes your pain, Mr. Samantha? Right, moving it. Does it hurt just when it's seated down? He says no, it doesn't. So, provokes is moving the muscle up and down. Or Q, the quality of the pain. Can you describe the pain for me, Mr. Sam? Alright, the quality of the pain is sharp when he moves it. R is radiates. Does it radiate anywhere, Mr. Smith? So, sorry, Samantha, does it go up your leg or down? He says it does not. Or S, severity. On a scale of 1 to 10, how would you rate your pain, Mr. Samantha? Alright, T is time. So when did this start happening? A few weeks ago? Okay, and has it been off and on or just kind of constant? He says it's been kind of constant. Alright, so that concludes the vital signs portion. Now I'm going to head over to the physical assessment. So, Mr. Samantha, can you tell me what your name is, right? Your name is your full name? Alright. Can you tell me who the current president of the United States is? That is correct. Can you tell me where you are currently? And what brings you to the hospital? Alright, so he's alert, he understands what I'm saying. I was having a conversation with you, so he's alert and oriented ×4. And so now his affect or behavior. His affect and behavior, he's calm, collected, he's alert, he knows what's going on. And right now he's calm and he's at peace, so he's not anxious or doesn't look like he's in pain. So I'm going to go ahead and start with the head. Since I'm going like it was skill check off, I would say that I would touch. I'd look for the hair, I'd feel the hair, the texture, the moisture, and we'll check the head for any edema. Alright, now I'm going to go over to full facial symmetry. Right, face is symmetrical. Then I'd go ahead and go down to the eyes. Right, so what I looked for the eyes was, so perla, pupils equal. Right, the pupils are equal. I'm going to go ahead and measure the pupils. Right, pupils are about 5 millimeters bilaterally. Right, pupils equal. Right, pupils are equal and they're circular. Right, equally reactive to light. Right, Mr. Smith, or Samantha, I'm gonna shine this in your eyes. Right there. Right, so they're reactive to both indirect and direct light. So they're so for the indirect light, that would be they're consensual. So now, Mr. Smith or Mr. Samantha, can you look at my pen light, please? All right. So they dilate, they go down. As it gets closer, eyes converge and constrict. And now I'm going to check the sclera. Sclera is white. And I would ask him to pull his eyelids down, check the bulbar and the palpebral conjunctiva. Right? The conjunctiva is clear over the eyes and pink under the eyes. Because the vascular area, there's no sign of drainage. Then I'm going to go ahead and check the sinuses. Do your sinuses hurt, Mr. Antha? He says they don't. I palpate them, check for tenderness, and then I'd go check for periorbital edema, and then I'd palpate the temporal arteries and grade them. So probably about a 1+, a little bit weaker than that. So I'm going to move down to the nose. Alright, Mr. Sam, I'm going to look up your nose with a pen light. Right, nasal septum is intact and I don't see it deviated. There's no nasal flaring when breathing in or breathing out, and there's no sign of drainage. And the color of the face is self-correction. Was examining the face a few steps ago. I would check to make the color of the face, the temperature, the moisture. So EMT, P, C, so color. E, check for any edema. M, moisture. T, texture, if it's intact, and the temperature of the skin. And then P, I check for any personal adaptations like nose piercings or any tattoos. Alright, so now I'm checking the color of the nose. Color of the nose is uniform to the rest of the face. Color is normal for his ethnicity. There we go. Ethnicity. So it's a little bit more pink. Now I'm moving down to the ears. Alright, ears are symmetrical. No sign of drainage. Alright, I don't see any hearing aids. Do you have any hearing aids, Mr. Antha? He says he does not. So I'm checking the color. Alright, color is uniform with the face a little bit more pink. So normal for ethnicity. Then I check the mouth. Alright, check the lips, make sure they're not drooping. Can you open your mouth, Mr. Antha? Thank you. you. Open mouth, check tongue. Can you stick your tongue out for me and wiggle it around? Alright, checking the back of the throat. Can you say ah? Alright, checking the back of the throat. Checking all around the mouth. No lesions, no sores. Mucous membranes, lips, and throat and tongue are all moist. And they're a darkish red color. Teeth are intact. Do you wear dentures, Mr. Antho? He does not. It doesn't look like he's wearing dentures anyway. So, can you say hungry, hungry hippopotamus? Alright, speech is clear. So now I'm going to go ahead, move down to the neck. So while I'm here, I'm going to have him at 45 degrees on the bed. Check bilaterally for JVD, which is jugular vein distension, or NVD, neck vein distension. Then I'm going to seat the head of the bed up to 90 degrees. Check again. Right, no neck vein distension or jugular vein distension at 90 degrees either. So now I'm going to check for carotid pulsations. Right, carotid pulsations are not visible bilaterally. Alright, so now I'm going to feel one at a time. Alright. About 2 plus bilaterally. Now I'm going to feel for the trachea. Make sure it's midline. Can you look up Mr. Smith? Or Mr. Antha? Thank you. Gonna listen for auscultate for breathing. Use the bell of my stethoscope. Alright, I don't hear any breathing. Alright, Mr. Smith, can you go ahead and lift your head all the way up for me? Can you look down? Can you tilt it to your sides? Can you look side to side? Right? Mr. Anther, that's full range of motion. Did that hurt at all? Nothing limited, not stiff. Okay, so now I'm going to go ahead and move down to the chest. Right, Mr. Antha, I'm going to go ahead and move this down. I'm going to inspect your chest, okay? So just to where the chest is visible. Alright, I'm going to go ahead and inspect. Alright, so C-M-T-A. C, so color is appropriate for ethnicity, a little bit lighter. See, E is edema. I do not see any edema right now. Right, E-N, moisture. Right, so now I'm going to go ahead and palpate. Don't see any personal adaptations like tattoos. So edema, I don't feel any edema. Right, E-N, moisture, so skin is dry. T, texture, skin is intact. And temperature is warm. And P is any personal adaptations, don't see any piercings, and I don't see any tattoos or any personal additions. Right, so now, Mr. Smith, I'm going to go ahead and listen to your heart, okay? So the landmarks, first I'm going to find the sternoclavicular notch, find the manubrium, go down to the angle of Louis, right at the sternal border, second intercostal space is aortic, second intercostal space left of the sternal border is the pulmonic, rib down, third intercostal space left of the sternal border is Erb's point, rib down, fourth intercostal space left of the sternal border is the tricuspid, rib down, mid-clavicular left of the sternal border is going to be the apical pulse, which is also known as the mitral. So now I'm going to auscultate those quadrants, or not quadrants, but all the points. S1, S2 noted. 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 Counting for apical pulse starting now. 61 beats per minute, and there's a regular rhythm, and there's no apical radial pulse deficit. So I checked that. Alright, I'm going to lower this down just a little bit more, Mr. Antha. So I'm going to go ahead and check for breath sounds. So I'm going to state the location of normal breath sounds. So up here is going to be the bronchiole, right by the neck. Right here near the sternum is going to be the bronchiovascular. Then the vascular is going to be like the C, about around here. So I'm going to check those, auscultate. Alright, Mr. Sam, if you can breathe in with your mouth. I'll cue you a few times, but I don't want you to hyperventilate. So after the first few breath sounds, if you can go ahead and just breathe normally, but breathe through your mouth, please. Alright, thank you. I'm going to listen for one full breath sound before moving the stethoscope. Alright, go ahead, breathe in for me, please. In, out, in, out, in, out. Alright, you go ahead and sit up for me, Mr. Sam. Alright, so could do that. Make sure it's between the. Oh, no. I just lost his head. Oh. Right. Don't choke your patient like I'm doing right now. Now I'm going to listen to lateral. Great, thank you, Mr. Sam. Ow. Alright, so regular breathing pattern. Don't hear any adventitious breath sounds such as stridor or wheezing. Thanks. Alright, so I'm going to go ahead, covering back up. Doing that. Alright, now I'm moving down to abdominal assessment. So, alright, I'm going to ask for urinary output. So, when was the last time you used the route you peed, Mr. Sam? Alright, a few hours ago. Do you know your frequency, how many times you pee per day? About 3. Alright. Do you, did it hurt when you peed last? No, any burning? Was there any blood when you urinated? Say it did not, no blood when you urinated. Can you describe that for me? Was it yellow, light yellow? Was it clear or cloudy? Alright, it was clear. Alright, that. Alright, now I'm going to go ahead and assess the abdomen. I'm going to go ahead and look at your abdomen, okay, Mr. Sam? So, on a normal patient, I inspect the genitalia at this time. Right, so I'm going to look. Alright, C, E, M, T, P. Alright, C. The color of it, the color looks normal for the ethnicity. C, E. So, any edema, I do not see any edema. See contour, I don't see, it's round, flat contour. Right, C, E, N, so N. The moisture, I will check that when I palpate. T, so texture, I'll check that later. Temperature later. It looks intact, I don't see any surgical incisions, any wounds. And then P, I don't see any personal adaptations such as tattoos or piercings. Alright, so now I'm going to ask for bowel history. So, when was the last time you had a bowel movement, Mr. Antha? Right, he said yesterday. Can you describe that bowel movement for me? Right, a normal bowel movement. Okay, so, do you have any flatus, which is gas? Do you have any gas buildup? Said he does not. And do you feel bloated right now? No, I don't see any, like he's bloated. Right now I'm going to go ahead and auscultate before I palpate, because I want to check for accurate bowel sounds. Alright, percussion. Alright, so auscultated sounds good. I don't feel so active times 4 quadrants. And now I'm gonna go ahead and palpate. Feel for any masses, any abnormalities. Do you have? But before I would have touched him, I would have asked, do you have any pain in any of your stomach? Says not, because if there was pain, I would want to palpate that the last. Right, and I'm checking for bladder distension, which would feel like a water balloon down there. Right, I don't feel any of that. So now I'm gonna go ahead, and I'm also feeling for temperature, moisture, and the texture. The texture is dry, so moisture is dry, texture is in hair distribution, so that's hair is evenly distributed. Same with the chest and texture. Yeah. Right. So now I'm going to go ahead and move on to the upper extremities. So I obviously, if he was wearing skin, he had skin, and it was a normal gown, I'd check for all that. So I'm going to go ahead and check bilaterally for any edema, the color, the C. So C, color, E, any edema. Right, color, no edema, a grade pitting edema if it was present. C, E, color is appropriate for ethnicity, bilaterally, don't see any erythema. Or pallor. Pallor, great, no edema bilaterally, check that. Great, now I'm going to go ahead and check for turgor. Skin turgor. Alright, there's no sign of tinting, so it's elastic. Now I'm going to go ahead and inspect the fingernails. Right. Right, the fingernail beds are intact, and fingernail beds are intact, and they look pink. Same bilaterally, check cap refill. Alright, wrist bilaterally, and so color, C, E, edema, and moisture, so they're dry bilaterally, and T, so texture, appropriate texture, no bumpy, it's not bumpy, not scaly or flaky, and they're intact. T and P, so there's no personal adaptations such as tattoos, breathing. Great, feel that. So now can you go ahead and squeeze my fingers, Mr. Antha? Alright, squeeze bilaterally, so they're strong bilaterally. Can you push up against my arms? Right, now go ahead and push down. Push out. Push in. Alright, so abduction is intact. Can you raise your arms all the way up? All the way down. Out. Back. Right, so full range of motion. And now I'm going to go ahead and check this. So sensation. Alright. This is sharp. This is dull. Right, can you close your eyes, please? Right, what's this? Dull, where do you feel that? Alright. What's that? And where do you feel that? Okay. What was that? Good. And good. Alright. So now I'm moving. Do you have any numbness or tingling? Great, he says no. So I'm going to go ahead and move to your lower extremities. Alright, so first thing I'm inspecting for color. Alright, color is appropriate for ethnicity. I don't see any varicosities, and do not see any edema. So I'm going to go ahead and feel. Alright, so C, color E, edema, no edema, M is moisture, so M, T, so texture is smooth, temperature, it's warm, T, and the skin is intact. I don't see any incisions, any cuts, bruises, and or anything like that. T and then P, no personal additions. Right, now I'm going to go ahead and feel the pulses. So I check the femoral pulse, which would be in the inguinal area. I check that bilaterally. Check popliteal pulses. Right, I can't feel that. I would get a Doppler. Same thing with the other side. I get a Doppler for the femoral pulse. For the popliteal pulses. Right now I'm going to feel the posterior tibialis pulses. Right, 2 plus bilaterally. And then the dorsal. Oh, I forgot what that's called. Dorsey. Alright, so now I'm going to go ahead and check nail beds. Alright, nail beds are pink and intact. Gonna check cap refill. Right, they're brisk. Right, they're good. Brisk bilaterally. Now I'm going to go ahead and can you push down against my hands? Right, plantar flexion's good. Up. Right, dorsiflexion is good. Can you push up against my hands? Right, down, down. Push to the side. Push in. Right, abduction and adduction is good. Can you go ahead and lift your legs, knees upwards, down, out, back. Can you move your feet? Right, full range of motion. And legs. Now I'm going to go ahead and check. Here, this is dull, this is sharp. Right, can you close your eyes, please? What's this? That is correct. Where do you feel it? Yep. This. Correct. Here. Correct. And here. Alright. Go feel there. Okay. There. Alright, good. So now I'm going to assess for DVT, so deep vein thromboses. So I'm going to check for the color. Right, there's no redness, excessive redness. I'm going to check the temperature. Right, it's not excessively warm, it's not freezing cold. And redness, there's no edema. I'd grade pitting edema present. I'd grade pitting edema by what we had the models in class. Push down, check the rebound of the skin, and grade it based on that, either 2, 3, or 4, in increments of 2. So there's no edema, and there's no sign of DVT. Alright, Mr. Samantha, I'd go ahead and wash my hands, document my findings. Alright, and skill complete. So that's that, guys. Hopefully that wasn't too bad, minus the fact of me forgetting the dorsalis pedis. That's what it is. Dorsalis pedis. I didn't look, I swear. Alright, so dorsalis pedis. Hopefully you guys got this. I believe in you.